Software engineer Tal Anker is demonstrating his gait analysis technology. He calls it SensorGo. It's a device that uses sensors strapped to a patient's legs to measure walking data that could point to underlying medical problems.
We extract the walking straight data, walking straight kinematic data out of a free walking, because gait analysis is done while the patient is walking straight. So we need to extract the data out of the overall free walking data. And then we use a proprietary algorithm to detect the gait cycle events.
The sensors measure patients' three-dimensional acceleration, rotational speed and direction of movement. Colleague Avishai Moron says raw kinematic data is sent to a remote SensorGo box, which produces results within minutes.
That box uploads the data to a web server over the cloud, and it uses SensorGo proprietary algorithms to analyze that data and gives just an easy to read report so that the doctor at the clinic or at the rehab center can read it and just give his diagnosis.
Gait analysis is used to assess, plan and treat individuals with conditions affecting their walking ability. Cerebral palsy and stroke patients are commonly seen in gait labs, but most current systems require X-rays and time-consuming walking sessions that have to be recorded on video. Anka says SensorGo is easier to use and less expensive. He says it could also help detect conditions before they become obvious.
There's a potential in neurology and detection neurology disorders, prediction risk of falling in the elderly population, osteoarthritis. The bunch of research papers show the correlation between gait parameters values and the functional status of the patient. Also, dementia can be detected early.
The developers say they are encouraged by successful patient trials conducted at Israel's Barzilai Medical Center, overseen by Dr. Omri Lebowski.
We hope using the SensorGo will enable us physicians to gather much more information about our patients in their native environment. This will enable us to know much more about their walking abilities and walking parameters at their natural environment.
Tal Anker says he hopes SensorGo will be approved for use in the United States and Europe by next year. For the elderly in particular, he says, the technology will be a huge step forward.